Loneliness is an issue that I began thinking about actually quite some time ago, before I was even in office. When I was practicing medicine up in Boston, I was practicing as an internal medicine doctor, taking care of people with diabetes, high blood pressure, different types of cancer. But what I quickly came to see was that the most common illness that I was dealing with was in fact not heart disease or diabetes, it was loneliness. And loneliness that stemmed from a lack of meaning, a lack of self-worth, and a lack of social connection. And so I became intrigued by this and started to see more of this when I was Surgeon General, when I would visit communities around the country. Very few people would come out and just say, I'm lonely. That's not how people would talk about the issue. But when given the right opportunity, when asked the right questions, people would start opening up about the fact that they were, in fact, experiencing loneliness. Just a few months ago, for example, I was doing a radio interview, and there were several people who called in at the end. And one gentleman in his 40s called in, and he said, my best friend died a few years ago, and I've been profoundly lonely ever since then. And I just don't know what to do about it. And as a guy, I feel like I can't really talk about that. It's not a very masculine thing to do, to say that you're alone. Another woman called in, and she said, my daughter just came back from her first semester in college, and I sent her to college thinking she's going to be with a community of people that she's connected to, who she has fun with, who appreciate her for who she is. But instead she came back and she said, Mom, I'm connected to people all the time. We're texting each other, we're messaging all the time, but nobody ever asks me about me. No one understands who I am. I feel so alone. So I've realized that loneliness is far more prevalent than I thought. In fact, if you look at the data, the numbers are in the 20s to 30%, depending on the numbers you look at. AARP, for example, did a study looking at people over 45 and found that nearly a third of them are in fact experiencing loneliness. So this is a profound issue. It turns out it also has public health implications.
Yeah, you've written some pretty startling statistics about the impact of loneliness.
Yeah, so if you look at health, what you see is that people who are lonely live shorter lives. In fact, the reduction in lifespan associated with loneliness is similar to the reduction associated with smoking 15 cigarettes a day. It's also greater than the association with obesity. So just imagine for a moment how much attention we spend talking about, thinking about, and addressing obesity and smoking compared to how much we think about loneliness as a public health threat. But folks who are lonely also have an increased risk of heart disease, of dementia, of trouble with their fighting infections, so they have a weakened immune system. And they also have a greater risk of depression and anxiety. But the consequences of loneliness actually go far outside of health too. It impacts your productivity in the workplace, it impacts how our children do in schools. And what I've begun to see increasingly is that it also impacts our ability to dialogue as a community. And so if you imagine the times that we're in now, when we are struggling with major challenges, whether it's the opioid crisis or climate change or other chronic illnesses, these require us to be able to talk to each other, to dialogue as a community. But we can't do that if we are in the chronic stress state that is triggered by loneliness.
So why would loneliness have the same impact as 15 cigarettes a day, just physiologically?
So it turns out there are probably at least two explanations for this. One is that it looks like people who experience loneliness actually have a difference in the health-related behaviors that they engage in. So they may be less likely, for example, to make the right choices when it comes to nutrition and physical activity. But there's another explanation as well, which is rooted in evolution, which has to do with the fact that loneliness triggers a chronic stress state in our body. So if you imagine thousands of years ago when we were hunters and gatherers, being a part of a group was actually very beneficial because it ensured greater protection and a more stable food supply. In fact, when you were separated from the group is when you're more likely to get eaten by a predator or die from starvation. Now, you think about the fact that that has been baked into our nervous system over thousands of years, so that in the modern day and age, when you are lonely, which is equivalent of being separated from your group, having inadequate social connection, it triggers a similar stress response. And included in that stress response is hypervigilance, right? And so I mention this because in a situation where you are surrounded by predators, you want to be hypervigilant. You want to think that the rock that just moved over there might be an animal that's trying to jump out and come to get you, even if it's not. But in the modern day, if your hypervigilance leads you to suspect that people with good intentions have bad intentions, to suspect that people who perhaps aren't even interacting with you are trying to point at you or trying to threaten you in some way, you can imagine how this impairs our ability to actually dialogue and to interact with each other. But the chronic stress that stems from loneliness, we know that that stress is connected with inflammation, which in turn is connected with higher rates of heart disease and many other chronic illnesses. So there are biological mechanisms through which loneliness may have its effect. That said, there are probably mechanisms through which we don't understand. But the bottom line is when you look at all the data on loneliness, the statistics, the biology of it, what you're left with is the inescapable conclusion that we need each other. We are fundamentally social creatures. It doesn't mean we're all introverts or extroverts, but both introverts and extroverts need some degree of human connection, even if we differ in how much that is. We haven't prioritized that really as much as a society. In fact, it's not that we have said connection is not important. We've just allowed ourselves to think that many other things are far more important. We've taken our eye off the ball in investing in human relationships, and that has had its consequences in terms of our health.